first clinical research lunch and learn session of 2025, and Happy New Year. I'd like to start by just gratefully acknowledging that our work at the Research Institutes takes place on the unceded, traditional, and occupied lands of the Coast Salish peoples, specifically the Musqueam, Squamish, and Tsleil-Waututh nations. And we're very grateful for the opportunity to live, work, and learn on these sacred lands. Presenting today, I'm very excited to introduce you to Tianna Rusnak. She is a coordinator on the data management team with the Integrated Research Informatics Services at BC Children's Hospital, so also known as the IRIS team. Tianna holds a master's degree in nutrition with a specialization in immunology from the University of Alberta. And throughout her career, Tianna has gained transdisciplinary research experience, collaborating with teams across a number of diverse fields, including in Indigenous health, climate change, and antimicrobial resistance. And just before I turn it over to Tianna, I just want to flag for everyone that we are in a webinar series format, meaning that everyone's muted and your cameras are off. So if you have questions, please feel free to drop them in the Q&A, not in the chat box, because if you drop them in the chat, we might miss them. So please use the Q&A. And I will turn things over to Tianna. Thank you so much for joining us today.
Wonderful. Thank you so much. Thank you for the introduction, and thank you all for being here. Being that I am a relative newcomer to these lands, originally hailing from Treaty 6 territory, I also want to acknowledge with gratitude that we are gathered on ancestral and unceded territories of the Coast Salish people. The Musqueam, Squamish, and Tsleil-Waututh, the First Nations have nurtured and cared for these lands and waters around us for all time, and I really give thanks for the opportunity to live and work here. So our learning objectives for today, and what I'm hoping that you'll glean some information on, is first what MyCap is and how it can potentially support your research. I'll spend quite a bit of time today talking about how to configure MyCap in a REDCap project. I'll touch briefly on the approvals that you'll need for using MyCap within a REDCap project, and then talk a little bit about global use cases of MyCap, just to kind of show how other teams have used it across the world. At the very end, we'll have time for questions, and then I'll also display some instructions on how to join a demo project of MyCap if anybody's interested. So MyCap is a participant-facing mobile application. So for those of you who are familiar with REDCap and its offerings, you'll know that REDCap actually has two apps. So there's the mobile app, and then there's also MyCap. The mobile app is used by data collectors that are REDCap users or your study team members that capture data from participants. So the REDCap mobile app is used when project team members are with participants but are out in the field or doing a home visit or in any other setting where internet may not be available. On the other hand, MyCap is used by participants. So MyCap is downloaded to a participant's mobile device or a device that is provided to them so that participants can submit data from wherever they are. So with the mobile app, it is the research team that holds the device and is collecting data. But with MyCap, it is the participants that hold the device, and that there's more of a bidirectional communication between the participants and the research team. So MyCap is both a tool for researchers as well as for participants. MyCap is a freely available and customizable app. The research team, there's no coding experience necessarily. It is integrated seamlessly into REDCap, so you can configure MyCap from your REDCap project. It supports remote data collection of patient-reported outcomes. So it can be really helpful for participants as it acts as a centralized study home for participants to access study information and requirements, and it can facilitate continuous participant engagement and participant retention. So getting into the app features, MyCap offers a number of features that can be really valuable for facilitating patient-reported outcomes. MyCap supports REDCap surveys. So if you look at this first screenshot, this is an image of the participant's homepage within the app. And you can see that it displays all the tasks, which can be REDCap surveys that the participant has due. MyCap also allows for data collection multiple times per day, which can be viewed by the participant either through the upcoming tab or through the calendar view in the app. MyCap also facilitates bidirectional secure messaging where participants can message the study team and the study team can reply within a REDCap project. And then not only is there a messaging feature, but MyCap also supports the ability to send announcements to participants. It is a little bit hard to see, but one thing I would like to point out is that the notification that a participant receives when receiving either a message or an announcement will never display the details of the message. No matter what the participant's phone setting is around being able to view the content of their notifications, the MyCap messaging notification will only ever say that there's a secure message waiting for them. MyCap also automates alerts on days where tasks are due, and the same goes for the task notifications. It will only ever display that a task is due and not ever provide any specifics of the task within that notification. MyCap also supports multiple participants on one device. So this can be very useful for parent-child studies, where the primary profile could be the parent profile, and then the user 2 could be the child profile. And then it also supports multiple studies on one profile, and there's no data intermingling between this. So what is on this MyCap, this first MyCap project, will be different than this secondary one, and the data will not be linked whatsoever. And then MyCap also supports passcode security. So this can be very useful in ensuring that the primary profile isn't accidentally entering into user 2 and submitting data there, and then just adding that extra layer of phone encryption. So not only would a participant potentially have a lock on their device, but then there's also this secondary passcode security. In providing a centralized research home, the app also supports providing resources to the participants. So you can set up about pages where you can give participants background on the study, as well as any other pertinent information they may need. You can provide contact information. So if you want the participants to have contacts outside of the messaging app, or perhaps you want to discourage the participants from using the messaging app, you can provide contact information and provide any further information for when participants might want to contact these specific people. And then you can also provide resource links. So in this example here, I have our hub pages and some MyCap resources that participants could click into and be sent to those external resources. And then MyCap also can capture mobile sensing, or what MyCap calls active tasks. So active tasks are activities that are performed by participants using their mobile device sensors under semi-controlled conditions. I'll get more into the specifics of this a little bit later in the presentation, but there is a wide range of active tasks that MyCap offers that have been developed by third-party developers. On the participant side, if you load these tasks into your project, they will see an explanation of what the active task is and how to complete it. So you won't need to worry about programming in instruction steps for how to complete these tasks. So for example, here, the tapping speed active task will measure how quickly a participant can alternate tapping on their phone with their index and their middle fingers, and then compare that between their hands. The fitness task will measure how quickly a participant can run or walk for 20 seconds. And then the spatial memory active task can measure short-term spatial memory by asking participants to remember the order in which the flowers light up. So this can just help to provide more diverse data collection on participant capabilities, such as fitness and cognition and range of motion. MyCap also offers support for multiple languages. So the app interface itself supports 17 languages. So this will set the language of the global app functionality, such as when the participant is logging in. And then the app also supports multi-language management integration for individual projects. So this will indicate or dictate the language of the MyCap tasks and all other features that your team programs. So these would be the languages that you have received REB approval to use and have translated yourself. So for those who are familiar with MLM, you would follow the exact same workflow in using MLM for MyCap features as you would for translating the rest of your REDCap project. And if you would like to know more about MLM, we do have those resources on our hub page, and you are always welcome to reach out to us. So when is MyCap a good fit for a study? MyCap is an excellent option for remote trials, but it can also be a good complement to in-person trials. This is especially due to its ability to support frequent or recurring data collection. You're able to capture data from participants on a regular basis, whether that be daily, weekly, or however frequently you'd like, without requiring them to come into the clinic or worrying about survey links getting lost in participants' inboxes. Of course, if active tasks are of interest to you, MyCap is a great way to offer these rather than going through a third-party app or developing them yourself. MyCap is a great option if your project wants to keep a line of communication open between participants and the study or the project team through its support of bidirectional and secure messaging. MyCap is also a really great option for projects that are wanting to increase accessibility by offering multiple methods of participant engagement. So just as a note, just because you have MyCap enabled in your project does not mean that all participants in your project need to participate through MyCap. And then MyCap can also be used in instances where participants may not always have a stable internet connection. So tasks can be completed without internet, and the data will be submitted back to the REDCap server once the internet connection is restored. So the general workflow for building a project using MyCap is fairly similar to how you would set up a REDCap project. So you would build your project within REDCap and designate which of the instruments you'd like to use in the app. You would customize any scheduling or any other information you want the participants to have during this build phase. And then you can change, or you can push those changes to the MyCap app. And then once you've tested your project and moved the project to production, you can begin data collection. So just as you would in a regular REDCap project, you'd first consent to your participants before collecting any data. And I have this colored in a different box as a reminder that this would either be through paper methods or through a separate REDCap project to ensure that the consent data is not being collected in the same project as study data. Once the participant has consented into the project, they can join your REDCap project and be provided instructions on how to join and participate via the MyCap app. Any data that the participant submits through the MyCap app is then synced back to the REDCap project, and any changes made to the REDCap project throughout the project lifecycle can be pushed back to the MyCap app. Okay, so I am going to now get into the bulk of how you would set up MyCap in a REDCap project. It can definitely seem like a lot of information at first, but if you can take anything away from this portion of the presentation, there are 3 areas in your REDCap project to focus on when setting up a MyCap project. So first is in the designer. So this is where you would designate and configure MyCap tasks. So if you've had any experience in building REDCap projects in the past, you'll already kind of have a general idea of how to do this. You can then design the look and the feel of the MyCap app through the app design. And then MyCap participant management will just have to do with all things around communicating and setting up your participants for success. So this is where you can invite participants to join MyCap, message them, and then troubleshoot any potential errors that come up. So looking at this screen grab of a test project, I have enabled surveys in the project. I have designed some data collection instruments and surveys. And then you'll also see that I have enabled the use the MyCap participant facing mobile app. Just as a note, if you enable this in one of your projects, the DM team will need to approve this request. At the time of requesting it, you do not need to have REB approval prior to us enabling it in your project, but you will need REB approval prior to requesting to move the project to production. Once approved, you will see the design and configure MyCap app on the project setup page. So this is where you can go into the MyCap app design, and then you'll also see these view MyCap initial instructions. When you first press enable, these instructions will come up, and it's a pretty in-depth list of all the things to be aware of when you're configuring your project. So if you ever get stuck or not sure what to do next, you can always refer back to these. These are a really great resource. And then the MyCap participant management, you can find under data collection. So moving to the designer page, first thing I want to note is anytime that I refer to MyCap tasks, what I'm referring to are REDCap instruments that have been enabled for MyCap. One thing to keep in mind is that the first instrument cannot be enabled for MyCap. And this is because in order for a participant to join the project on the MyCap app, they must first have a record in your MyCap in your REDCap project. And that record is based on the first instrument. So this first instrument could be as simple as just the record ID, or you could collect more data. In this example, I have enabled the first record as a survey. So participants are able to enter the project via a survey link. They'll submit the data for that first instrument and then be provided instructions on how to join MyCap from that survey. Another thing I'd like to bring your attention to are these MyCap options. So there's the app design here, and then I've just highlighted the baseline date settings. So by default, any instrument that has been enabled for MyCap as a MyCap task is scheduled based on the install date. So the install date is the date that the participant joined the project on the app. However, if you have an event that you would like that the participants have gone through that you would like tasks scheduled against, you can set up a baseline date. So if you click into this button, you'll be taken to this pop-up where you can check off that you'd like to use a baseline date. And then you need to select a field that has been formatted as a date field in your project to be that baseline date. If participants are going to be providing the baseline date through the MyCap app, the second section is setting this up. So you'll want this to be something that the participant would recognize. So I'm using the example of a discharge date. So first you would set up a yes/no question on whether or not the baseline date was today. So my question is, were you discharged from the hospital today? And then you can set up a secondary question if the participant answers no to that first question that asks when the baseline date was. So here it would be, when were you discharged? You're also able to include an instruction step if you are if you're worried that the participants might not know exactly the date that you are asking for. So when you press enable on an instrument that you would like to be a MyCap task, you'll see these MyCap settings pop up in the designer. And this is actually the page that you are automatically directed to when you enable an instrument to be a MyCap task. So you're brought to the MyCap setting pages. So there's several settings that you can configure. I'll zoom in on the top part of the page. So this task title will be what is piped into MyCap when participants see that task. You can then set the format for how you'd like things to appear for the participant. So you can set it as a questionnaire where each question will appear on its own screen, which is recommended. Or you can set it up as a form where all questions will be on one screen and the participant will need to scroll. So definitely not recommended if the form is too long. You can also set up the card display. By default, it'll be %complete. So if save and return later is enabled on the task, if a participant leaves and comes back, they'll be able to see how far they've made it through the MyCap task. You can also set up this chart display for any values that you are collecting, any quantitative values you're collecting over time. So if you are collecting daily heart rate or blood pressure, you could set this up. And then as the participant puts in more values, it'll start to generate a chart. There are optional settings for retroactive completion, allowing save and complete later, including an instruction and a completion step. And then on the bottom of the MyCap settings, you can set the task schedule. So you can determine if you'd like the task scheduled based on the install date or based on the baseline date. You can determine how many times you'd like this task to be completed, if it's going to be a one-time task, infinitely repeating, or repeating on a specific timeline, whether that be daily, weekly, etc., or if you want it to repeat on a fixed amount of days. You can determine if you want the task to be delayed based on the install or baseline date, And then you can, if you have it set as an infinite or repeating task, it'll also prompt you to dictate when you want the task to end, whether that's never, or if it's after been completed X amount of times, after X amount of days, or on an exact date. One thing to note is when you enable a task for MyCap, you'll receive a notice in the MyCap settings letting you know that MyCap is automatically going to add in a set of fields to your instrument. So don't modify these fields. They are hidden to the participants, so they will not see them. But MyCap needs this information, and it might be valuable to you as well. The fields that I'll be collecting are things like the task start date, end date, so you can tell how long it took to complete the task. There's also the scheduled date, so you can see, for example, if you scheduled the task to be completed on a Monday, but the participant didn't complete it until Friday. This might have implications if the task was time sensitive, or if it involved recall. You might want to consider how accurate that information might be. The supplemental fields will give information on what type of device was used, what version of MyCap that the device is using, as well as other data that can be really helpful for troubleshooting. And then this UUID is the MyCap task ID. So this will be a different value for each task that is submitted by a participant. And then if you do accidentally modify or delete one of these fields, REDCap will flag it and prompt you to fix the issue. But fortunately, it provides you a button that you can just click, and REDCap will do this automatically for you. So coming back to active tasks. This is a library from the third-party research kit. So as mentioned, active tasks are designed to utilize mobile device sensors, microphones, or speakers to capture data from participants. So you can import active tasks from the designer, and then after you import the task, it'll show up in your list of instruments. So if you import active tasks, you'll be taken to this whole library of offerings. One thing to point out, you'll see these two columns here that say MyCap Classic or MyCap. MyCap Classic is the app that has been retired, so you don't need to worry about this column. Now just know that the active tasks can be completed both by Android and Apple devices. So as mentioned, these tasks are developed by third-party programmers and researchers. So while the MyCap developers have added these active tasks, they do not have expertise in the return results. So it's up to the end users or the study teams to ensure that the return results can be understood and analyzed. So we highly recommend that you're testing not only the implementation of the active tasks within your program or your project, but also the analysis. The data that is provided does require some background knowledge of how to analyze. And while at the moment the REDCap consortium doesn't provide support for this, they do plan to in the future. And if this is something that you want to implement in your project and you want help with analysis, we can always help you with finding the resources to do so. So if you go and click Add on any of these active tasks, you'll be taken to another version of the MyCap task settings. So some configuration can be implemented for active tasks. You can, of course, schedule the task, but there's less customization available as these are pre-programmed tasks. So once you have configured your MyCap tasks, you can begin configuring the app design. So you can find the app design from the project setup page as well as the designer page. And this is where you can design the user experience. So this is providing the about pages, the contacts, links, and designing the theme. For the about page, you do need to have at least one, but you can program several about pages. So you'll have a title, your page contents. So this is where you can provide any background, anything that you might want the participants to first see when they open the app. You can add in your logo here. And you can also click this button here to see how it will look for the participant in the app. For your contacts, you can provide contact information to make available for participants if they need to contact someone outside of the messaging app, or if you elect not to use the messaging app. So you can add the title of the contact, their name, phone number, email, any site URL if applicable. and then provide any further information when this participant may want to contact this person. Another great feature that MyCap offers is the ability to provide relevant links to participants within the app. So for example, if you were doing a mental health study, you could offer various mental health resources, as well as any links to hotlines or emergency services. Or if you did have something like an external event schedule, you could provide the link to that external resource. So you would configure the link name, the URL, and the icon, and you can provide as many links as you'd like within the MyCap app. Oops. And then finally, within app design, you can select a theme for the participants. So you can choose one of these pre-programmed themes, or you can also add in your own colors here. There's a little legend for which specific color each would apply to. There's a little note here that it's not available on Android devices. The themes don't fully come through. They still sort of work. This is a small detail, but I do want to point out that there will still be some color change for Android devices. And then after you've done your app design and configured your MyCap tasks, a really important step here is to publish a new MyCap version. So anytime you edit anything to do with MyCap tasks or the app design, you want to make sure that you publish a new MyCap version, which can be found on the designer and the app design page. So REDCap will let you know when this configuration is out of date. However, please know you can never overpush this. So when in doubt, publish a new MyCap version. Participants don't need to do anything on their end. So MyCap will automatically load the most up-to-date published version of the app. And then the last point for configuration is the MyCap participant management, which can be found under the data collection menu on the project setup page. So MyCap participant management page can help you track who has installed the app of all of your participants. You can invite participants, you can look at the messages, look at the app sync issues. But one of the most important parts for sure about this page is inviting participants. So when you click on invite participants, you're provided some guidance on how you can invite your participants to use the MyCap app. So participants can join your project on the MyCap mobile app using a QR code or a hyperlink that is unique to their record in your REDCap project. A participant's record must already exist in the REDCap project in order for them to get that QR code or the hyperlink. So this step of inviting participants to MyCap occurs after their record in the REDCap project exists. So as mentioned before, this is either done by creating the record via a data entry instrument and then sending out a MyCap invitation, or having the participant complete a REDCap survey and receiving that MyCap invitation. So first you can determine the invitation format. So you would choose the QR code if participants will be receiving the invitation via a desktop or a different device than the one that they'll be using, so that they can use their phone camera to scan they can scan the QR code within the MyCap app. And then if participants will be receiving the invitation on the same device that they'll be using for MyCap, you can provide a hyperlink, which will either take them to the app, or if they haven't downloaded the app yet, it will take them to their respective app store. And then if you aren't sure which they'll be doing, you can also just offer both the QR code and the hyperlink. So once you've selected your format, you can copy the generated invitation text. So you'll be wanting to copy the HTML of the generated invitation. And you want to make sure that you use the HTML, as this is important in ensuring that the hyperlinks and the QR code generates properly. So going into the HTML, you can copy this to your clipboard, and then you can paste it in a couple different ways to send this out to the participant. So the first way you can invite participants to MyCap is using the alerts and notifications. I won't go too into the specifics of how to set up alerts and notifications right now, as this is a separate feature, but please know that we do have lots of resources on how to set up alerts on our hub pages. But when you do go into your alert and go to generate the body of your invitation, you can include the invitation instructions in that message. So to do this, you would click into the source code and copy that, paste that copied HTML, and it will generate the invitation text. So when a participant record is created through in the REDCap project, either through data entry or survey completion, you can set it up that the alert will send out once that is completed, and it'll be sent to the participant's email. So it'll look like this. So please note with this that setting up MyCap invitations in this way will require explicit approval of storing emails in your REDCap project. The other way that you could invite participants to your MyCap project is through the survey completion text, which is found in the survey settings of the instrument. So you can pull that same HTML into the source code to generate the invitation. So participants would see this once they complete the intake survey. So using this option does not require collection of emails. So this would be the option to choose if you do not have email collection approval or that you need to keep your project de-identified. So in this example, a participant would enter the participant intake survey. There isn't actually any data being collected, but it's just serving as a landing page. And then when they go to click submit, they are taken to that survey completion text where they can choose which way that they'd like to enter the app. Please note that if a participant tries to click on this hyperlink on a desktop computer, it'll just tell them that they need to open the link on a mobile device. Another feature within participant management is the ability to send secure messages to your participants. So in your inbox, you can find any conversations that you have with participants, and you can respond to participants individually here. Or if you want to send out a message to all of your participants at once, you can use that announcements tab. When a participant joins your project, they'll be able to see all announcements that have been sent out even before they join the project. So this can actually be a really great option if your team decides that you don't want to be using, you don't want your participants to using the message feature. You can set up an announcement to tell participants that the messaging app is not being monitored. And if participants need to contact the study team, you can provide alternate contact information. Announcements would be another great option for if you are going to be using the messaging app. A disclaimer can pop up saying, if you want to contact us through here, please don't provide any identifying information or something like that. So looking at our inbox right now, we see a message. We see that there's action needed on this, and then we can click in here to view and respond to the message. So in the message, you can then respond back to the message as well as unclick the checkbox on whether or not action is needed. Please note that this inbox is global to all users within your REDCap project. So changing whether or not action is needed for a message will change it for all users in your project. So just briefly going to talk about app sync issues. So app sync issues occur when you have made an edit to an instrument, but didn't publish it, and then a participant tried to complete that specific task in that kind of gray zone. So for example, if you deleted a field, but then you didn't publish the new version, and then a participant tries to complete the survey, but since their survey has an extra field, REDCap won't know what to do with it. So you can look into the details of the app sync issue here, and it will show you all the data that would have been ingested, but it didn't because there was the specific error. So I won't go too in depth in this now, but if an app sync issue occurs, you will need to manually input the data into REDCap. MyCap is not able to resync the data once the error is addressed. However, fortunately, these app sync issues are pretty rare, and you shouldn't run into this issue if you ensure that your MyCap version is always up to date. And if you're submitting changes that we need to approve, we'll always remind you to do that and probably also click the button ourselves. So just keep in mind that if you do run into this issue, this is how you deal with it. And you can, of course, always reach out to us if this happens. I just wanted to also briefly mention that MyCap can now be used in longitudinal studies. So when configuring MyCap settings, you will need to designate which event the task is associated with. In the current version that we're running of REDCap, longitudinal MyCap projects cannot use repeating instruments. However, this will change in the next LTS update. So this is upcoming relatively soon. And then briefly chatting about approvals for MyCap use. So for research projects, REB needs to be aware of MyCap use. So be sure to include this information in your application and amendment. You can, of course, always reach out to us to help generate the language that you'll be using in your application. As mentioned before, if you're going to be using alerts and notifications for MyCap invitations, you need to have explicit approval to collect those emails. And then just a general note to keep in mind is that MyCap projects are never anonymous. If you're not collecting identifiers, it'll be de-identified, or of course identified if you are collecting something like email or other identifiers. Approval for MyCap use in QA may be coming later this year, so stay tuned for that. And then just a note to standalone surveys and e-consent projects, MyCap is not permitted. Standalone surveys, of course, you would just be sending out one survey, so MyCap is not fit for purpose with this. And then with e-consent projects, the e-consent framework is not configured for MyCap. So there wouldn't be a way to certify your consent, and therefore it's not compatible. And then the last dryish slide here, we do have a full document on our security details, which also is available on our HUD page if you are curious on specifics or what you would like more information for your REB submission. But just as a general overview, data is transmitted to and from the app using a secure encrypted transmission. And then for increased security, it also verifies the integrity of the data. The data stored on the participant's phone is also encrypted. So encrypting the data on the device prevents any unauthorized users from accessing the data in the app, even if they were to gain access to the device's file system in some sort of way, whether that's through a direct hardware connection or through other software on the device. So all that to say that the data is secure, and it's secure. As mentioned before, the product data is also isolated. So for example, if a participant was in two projects, data in project A will not affect data in project B on the same device. There is no data intermingling. And then once data is transmitted back to the REDCap server, data is completely erased from the phone app. And then just wanted to kind of touch on how MyCap has been used for other institutions and just kind of provide some of the things that have been published in the literature. So this team here evaluated the feasibility of using MyCap for real-time patient-reported data collection during latent labor. Participants received a notification every 3 hours to provide more data on their labor. And out of the 18 enrolled participants, 13 recorded at least one symptom report during latent labor, 4 reported qualitative data during labor, and then another 14 recorded qualitative data in the postpartum period. So the team was really able to get data on common symptoms that participants experienced, as well as qualitative data in this very specific time period that would be hard to do without using participants' phones. And of the 191, there was a total of 191 symptom reports with an average of 10 per participant. The team also published this figure here where they just showed an example of how they were using MyCap. So they had a MyCap task that was asking about labor symptoms. And then they had a MyCap task around the hospital. And it looks like they were doing audio recording here. So they're utilizing those active tasks. There was another team that monitored anxiety levels of patients with multiple sclerosis while enrolled in an intervention that assessed the use of attention bias modification training for anxiety reduction. So participants completed questionnaires related to depression, anxiety, and affect on MyCap, and they did this during the pre-intervention period, weekly during the intervention, and then post-intervention. So this was a feasibility study. So 74% of the 34 patients completed the full intervention, and 100% completed at least 50% of the targeted intervention use. So researchers did conclude that the feasibility criteria were met for using MyCap in this way. Mount Sinai utilized MyCap to monitor patients who recently suffered a stroke or were at risk for stroke to assess the need for triage and care. Patients assessed their blood pressure and heart rate daily and entered those values into MyCap. 12 patients participated. There was a 70% daily adherence. 16 triage events were initiated. 11 were able to be triaged to a referring physician, 2 to urgent care, and 1 to the primary care physician. So once again, leading the researchers to conclude that this was a feasible method for using MyCap. And then last one here, this was a home-based mobile health exercise intervention for patients recovering from transcatheter aortic valve replacements to track exercise adherence and progress. So participants were assigned exercises, they answered daily and weekly questionnaires, and tracked all their progress on MyCap. Researchers found daily compliance averaged to about 85 to 90%. And while the primary parameters, which were increasing daily steps, that was not met, the intervention did improve secondary physical activity parameters, including moderate to intense daily active minutes. So I hope this was interesting to all of you, and I hope that this maybe inspired you to consider using MyCap in your projects if relevant. So I just wanted to provide you with some key take-home considerations, both in whether or not MyCap would work for a project in the future for you, as well as how you would customize the projects. So some base level prerequisites to ask yourself or your study team would be, will the participants have or be given a mobile device? And will the participants have internet access? While they don't need consistent internet access, it will at least need connection at some points so that the data can be submitted back to the REDCap server. And then under considerations, things to think about are how frequently you'll be asking participants to complete the data, so how you'll be setting up those task schedules. What types of data are you hoping to capture remotely? Are you considering using those active tasks? And if so, will you know how to analyze that data? How will your participants be recruited? Will you be sending out surveys? Will you be sending out alerts? If you are using those alerts, you'll need to ensure that you have the appropriate approvals for that. And then will you need to support non-English speaking participants? So if so, ensuring that you have already the approval for multi-language management, knowing how to set that up in your project, ensuring that you've translated everything appropriately. So yeah, just some things to keep in mind if this is of any interest to you. So we have time for questions now, but if you do have any questions in the that come up, you can always reach out to us at redcap@bcchr.ca. And then I would also wanted to leave you with a potential to see a MyCap project in action. So if you'd like, you can join a MyCap demo. To do that, you can open your phone camera and scan this QR code. The QR code will take you through that survey that I demoed earlier in the presentation and walk you through the steps to join MyCap. There are a couple steps to get there, so I have thrown in some photos to do this. And then also here's the QR code too, if you missed that on the last slide. But so you will scan the QR code using your camera. You'll be brought to that landing page. You'll click submit, and this is the survey completion text showing you the link to join MyCap. If you haven't downloaded MyCap on your phone before, then you'll be taken to your app store. Once you've installed the app, it should pop up to say that there's a pending study for you to join. You can press OK and join the study from the dynamic link. If you run into any issues with this and it says that there is no study to join, you just have to go back to your browser here to click the link again. And then you will have hopefully made it to our Lunch and Learn demo project. So you can test out to see the user experience for the about pages and the resources within the app. There's some MyCap tasks that you can try out and just see how that looks, and just poke around in any other way that you may want to within the app. But yeah, I'm happy to take any questions, and thank you for your time.
Thanks, Tianna. I took an attempt at answering a couple of questions while you were giving your talk. Just because they're recording this, I don't know if you want to read out the couple that were answered, provide your expertise, and then we can get into the ones that are unanswered. in the
Yeah,
Q&A?
that sounds good. That sounds good. Let me pull up the chat.
So I'll just read Matthias's question while you're getting the Q&A open. So the first one was, well, sorry, Matthias, I answered these in different order. But can you make your own active tasks? And if yes, in what programming language are they made? Or they use some other framework? So at this time, the consortium has not allowed for custom active tasks. It is something they are considering though. And so they've suggested for those that are interested that they get familiar with the Flutter cross-platform framework and the Dart programming language. And the last update I was able to find on this is about 6 months ago. Tianna, I don't know if you've seen anything further.
No, I haven't seen anything further in allowing it, but yes, it is intended that this will eventually be allowed. It isn't supported at this time.
And then the other question was, so participants can't see how their own data changes over time, so alternative means must be provided for this. So my understanding is that if you enable the chart option, participants can see how that information changes over time. But Tianna, or Matthias, if you want to clarify specifically what you were referring to in this question.
Yes, my only additional it still has the same capabilities of REDCap. So if you are wanting to provide more data visualization, that would still need to be done in externally in something like Power BI. But yes, with those quantitative values that you're measuring over time, you would be able to use the chart display for that within the app. And then Jane asks if the data is erased from the phone once transmitted to the server, does it mean that the chart function using the data from the server? That is a great question. And I don't want to answer it without knowing for sure. So Jane, I'm very happy to test this out and get back to you. Presumably it should stay if you're trying to measure this over time and display it to the participant, but I want to be able to give you a full concrete answer on that.
And the other two questions from Matthias, do you want to take a crack at those?
Oh, sorry, I see they're answered and then opened. Okay. Can MyCap notifications and tasks be dynamic, i.e. not pre-scheduled, or other be dependent on other data, such as calculation or results of previous surveys or derived variables? So right now, a lot of those like calculations on different variables are not supported within MyCap. I know that the consortium is hoping to continue to add more customization with this. But right now, I would say that most of the notifications around tasks being dynamic would not be supported. And for the second question from Matthias that hasn't been answered, are the notifications when new messages are sent out to outside tools, for example, by email, as for other notifications for when new messages are sent out to outside tools by email, as for other REDCap events? Sorry, I don't know if this is not computing in my mind.
I don't think there isn't any way for the app to actually send out an email or anything from within the app on the participant's phone. So it's not possible, so we don't track that. And then any notifications or emails or anything else from REDCap events, those are still tracked within the REDCap project itself as like per usual, because as Tianna mentioned in her presentation, you want to learn, or Matthias wants to learn how a study team would know that a participant messaged via other than having to check into the REDCap project.
That's a great point, and something that the consortium has pointed out is that you would be proactively checking. However, it depends how often you're going into your REDCap project, but if you are entering their project setup page, you'll get a red notification by the participant management. So you won't have to click into the participant management to find that. It will display right on the project setup page. But yes, you are correct that you would have to proactively be checking this. I can follow up to let you know if there's any changes in hoping to address that. But right now the consortium has addressed that. That is the only way to check to see if a participant has messaged you.
The other thing, and I don't think you mentioned it, Tianna, is that two-way communication is kind of it's not always something that's encouraged. So you can just kind of put an alert in that message box, which the alerts, that's where they display, saying something like, the messaging system is not monitored. If you need to reach out to our team, go to the contacts page and they're provided there. And if you need resources, do XYZ, something along those lines, to try and discourage that two-way communication.
Yeah, or even knowing that it won't be answered necessarily, and like if they have something time sensitive to use another form of communication.
Does anybody have any questions about installing MyCap? Did anybody follow the QR code?
Give people a couple more minutes, but hopefully everyone has our email. I'm sure you've all communicated with us at some point if you've interacted with REDCap. So you're always welcome to send messages, any clarifying information. We do have a lot of information on our hub pages around MyCap. But as I mentioned, it can definitely seem a little bit overwhelming right off the bat, but we're here to help in helping you determine if this is a good fit and how to set it up within a project. And then one other thing I would like to point out is that there's a MyCap template in demo. So if you did want to test this out in demo just to see if it's a good fit, there's a way to do that there as well. The DM team will still have to approve that, and it's just so that we can open up a dialogue and helping you kind of see if this works. But yeah, you can always see it for yourself on demo as well.
Great. Are there any other questions for Siobhan or Tianna? No, just a round of applause. That's wonderful. Great. Well, thank you so much, Tianna, for that amazing presentation of MyCap. It's really exciting to have you share these new updates. Thank you, everyone, for joining us for the January Lunch and Learn. And just to flag that next month's Clinical Research Lunch and Learn is on Wednesday, February 19th from 12 till 1. And it will be our Research Ethics Board at Children's and Women's coming to present. So Jenny Prasad and Dr. Holly Longstaff will be presenting. So please stay tuned for that. Thanks, everyone. Have a good afternoon.
Thank you.